Hi everyone, welcome back. In this week's presentation, we'll continue our evidence-based practice playlist. And this presentation is about how to search for evidence using the PICO clinical question method. So we'll talk about this in details. And the search process in general has steps to it. The first step is to create our search question. Like you have in mind something you want to search for, but you have to go systematic by formulating a search question or clinical question. There is a method called PICO. This is acronym. I'll speak in detail about how to use this method in the upcoming slide. So then we highlight the key concepts from the search question and build the search terms to use them in the mesh browser of PubMed, as we mentioned last presentation. We'll do that practically here and determine the database that we will be looking at. So most of the time, the clinicians will be looking for research and articles in PubMed and identify the designs of the study that we are interested in. And then we execute our search using the key concepts that we made. After that, an important part to finalize your search is to save your search results. So a well-built search question follow the PICO method. So let's see what this acronym stands for. The P stands for population that you are studying or the problem that you are looking for. So either population or problem or target group. Like we'll practice that by one example. But for example, you are looking for something in geriatric, or something in children, adults, young adults. So you determine this question is about which target group. That will help you get more specific results from your search. The I stands for the intervention or the exposure that you are doing. You are looking for a treatment, medication, you are looking for investigation you are looking for a risk factor. You determine what's the exposure of the intervention that you are aiming for. The C stands for the comparison intervention. For example, you want to see the benefits of nebulizers versus oral steroids to control the asthma frequency in a child, for example. You have to be specific by determining what you are looking for and what is the comparison intervention that you are looking to find which one is better than what. For example, these are just examples. And then the O stands for the outcome of interest. So in the asthma example that we just mentioned, you want to control the weekly episodes, you want to improve the compliance of patients, for example. You have to determine what is the aim or the outcome of your intervention that you are searching. So these are the PICO letters and what they represent and how they will help you in your search to find specific results towards your clinical question. So we'll take one example and apply the PICO method and apply also the PubMed search from the mesh database. So for example, we want to know what are the weight loss medications for adults. What are the available medications for adults? So let's start with the P, the population here. We can determine we are interested in adult population in general, or young adults, or 40 years of age and older, or seniors. There is a room for you to determine what your search will get you in the results. So the population is the first element to be determined. Then the intervention. Here in this question, the intervention is the weight loss medications or drugs. The comparison versus the surgical interventions. And the outcome, we want to reach the normal weight. So the question will be, what are the weight loss medications for adults? We highlight the key concepts, which are weight loss and medication and adults. So what we will do, we will go to the PubMed mesh browser. Just type in your browser PubMed. You will find the PubMed main page. And let's do that practically here. Okay, As we said, we go to PubMed. We did this last presentation, but we are doing the practical part right now to consolidate our knowledge. So this is the main page of PubMed. We select mesh database here, and we start searching for our key words that we highlighted in our clinical question. So the first one, we said weight loss. Let's see weight loss. What is the standard index for weight loss? We find the first one, weight loss here, easy peasy. We add it to our search builder box. We just click add to search builder. Next, we have drugs or medication. Let's type medication. And the standard word is pharmaceutical preparation. So we select this and add it to our search builder. Remember, we have here and. So we have weight loss and medications. So we said we want to compare medication or the drugs versus surgical intervention. So let's type surgery and see what is the standard word here. General surgery, no, we don't want that. Surgical procedures or operative. We will select this one because we are looking for weight management surgical procedures or weight reduction, any surgical procedure. So we will select this. And we want to add it here, but not add. So we are searching for the weight loss medication, not surgical procedures. Remember, we can change the and here into or not. In this situation, we want to select not. So we want to search for weight loss medication, not surgical procedures. Because if you kept it in general weight loss, it might give you some options. Here we are, it might give you surgical options. Here we are looking specifically for the weight loss medications. So this is how you adjust from this drop list between and or are not, according to what's your aim from your search. So in this situation, we click not, and then we add. And then we have our search builder finished, weight loss and pharmaceutical preparation, not surgical procedures. We proceed and click search PubMed. So as you see here in this screen, we have 1,022 results. That's a big amount of articles. We're not reading all of that. So we will go ahead and do some specifications from our left side menu by selecting full text, full free, or free full text, so that we have no issue in accessing the article later. And then we can select associated data. I mean, it's flexible. I'm just showing you how you can reduce the number of the articles that you get from your first search. So you also can add some specifications to the article types. We're not looking for books right now here. We're trying to find the studies, whether clinical trials, meta-analyses, randomized control trials, reviews, or systematic reviews. I mean, it's also up to you to select, but I want to show you practically how our results came down from 1,022 results to only 63 results by just determining the types of the studies and the availability of the articles. We can also select the publication date. For example, if you check the articles for the last 10 years, this is more than enough. You can be more specific if you want to look the articles published in the last 5 years. It's also up to you. You can custom the range to anything between that. So most of the time, 10 years is enough. So let's select 10 years. And now we only ended up with 39 results. So we can also select only English publications. And yeah, here we have 38 results. That's more than achievable. Like we can go through 38 results because this is not the final steps. You can go through the titles of the papers from the list that you have, and you can pick your preference. After you picked, say, for example, you want to read through this one, and so on. You have the option to save the articles that you got into either a Word document. You can select sending them by email, to your personal email or to somebody who's working with you in that topic, for example, or send to whatever you have. For example, some applications help with the bibliography like EndNotes or other applications. So you can also send these articles to your preference way of saving. So this way you can keep them handy for you next time when you come and look for what you ended up having. You will not like come again and process the search, because sometimes for any reason you might lose the results that you already searched up. Let's say you have to go for something else, and then when you came back you didn't find your search results. So the best thing is to do, as soon as you get the results, you save your search results or send them by email to a secure place. So next time you will start from where you ended this time. So let's go back to our PowerPoint presentation. All right. So as conclusion of what we have done, we determined the concepts, the medications, weight loss, adults versus surgical interventions. We found the mesh terms for each of them, and we transferred all of that to the search box. And the search result is for the weight loss and pharmaceutical preparations and adult, not surgical procedures, led us to what we had in the previous slide. So as we said, an important part of our search is to save our results so that they will be handy for our use. And that's it, basically. That's what you need to do. It's not a complicated process. It's just need to have the knowledge in your mind and apply it. So the steps are simple. Write down your question, highlight the key terms according to the PICO method, and then go to PubMed, search, and you will find the results and determine what specifications you need to do. And that will lead to the search results. Save your results, and you are good to go. I thank you so much for your attention, and we'll wrap up our evidence-based medicine playlist with a final presentation, and we'll move on to a different playlist in the upcoming future. I hope you guys find all of this helpful, and thank you so much.